all of us here.
Sure. Yeah. Well, there were 20 fantastic, remarkable stories. I've met 500 plus people, but I'll highlight two or three stories here, and I'll go through them and use their exact quotes. These patients, what they said, what they experienced. That might be helpful and bring a little bit of humanity to the stories. So first, there's Diane Klinke. I'll talk about Diane. Diane had pancreatic cancer, and she was told, "quote You have 3 months to live. We can arrange for hospice care." So basically, one Friday in February, and this is Diane speaking, one Friday in February of 2004, while working at an insurance office in Green Bay, Wisconsin, the entire staff came down with a nasty virus. Everyone went to the emergency room. Diane had blood work, she was given a shot, and the following Thursday, 6 days later, she had an ultrasound at a local hospital. She was told she should spend the night at the hospital for more tests. She visited with her doctor the next day, and her doctor said, "You have a very large tumor in your pancreas, 3 tumors in your liver, and tumors around your portal vein." A few days later, a surgeon in Green Bay told Diane, "This appears to be a widespread cancer. You might as well go home and get your affairs in order. You are inoperable and don't have long for this world." Imagine hearing those words. Well, she had medical records that were sent immediately to a well-known hospital in Minnesota. She had her liver and pancreas biopsied. Diagnosis was cancer, obviously. The oncologist and surgical oncologist said, quote, "Your chances of survival are maybe 1%. I would give you maybe tops 3 months to live, and we can arrange for hospice care." Back in Wisconsin, a Green Bay oncology group was willing to treat Diane with chemo despite the grave prognosis. They said, quote, "Eat anything you want. You need calories, ice cream, whatever." Diane said, "I have cut out sugar and dairy, and I am now taking vitamin C supplements." The Green Bay doctor said, "We won't treat you if you take vitamins. It will interfere with the chemo." The doctor said, quote, "Lady, you are terminal." Prior to starting chemo, a relative of Diane's recommended the Block Center for Integrative Cancer Treatment. Diane postponed her chemo appointment and made an appointment. Dr. Block offered hope. No promises, but he said, quote, "I think we can alter this cancer." Dr. Block continued and said to Diane, "The immune system is like an army. We need to strengthen the army to stop the progression of cancer and to strengthen the body." Basically, his treatment strategy was as follows. Chronomodulated chemotherapy, in other words, timed distribution, as we discussed earlier, with supplements and vitamins prior to the chemo to help the normal cells survive the harsh side effects of chemotherapy. Secondly, supplements and vitamins. And Dr. Block prescribed literally 50 to 80 specific supplements per day, tailored and personalized for her specific condition based on objective blood work and other criteria. Number 3, a nutritional strategy. Organic vegetables, fruits, whole grains, beans, spinach, green tea, almond milk, fish, no sugar, no fried food, no red meat, no dairy, no foods with white flour, which are simply bad for you. Simple carbohydrates as opposed to complex carbohydrates. But a nutritional strategy catered for her situation. And number 4, a mind, body, and visualization approach, working on psychosocial and biobehavioral issues to reduce stress and to get her in the right frame of mind moving forward. So essentially, chronomodulated chemo approach, supplements, nutritional, mind, body, and visualization. And oh, by the way, also there was exercise regimens included. Diane said, "You must make your body inhospitable to cancer. Diet, supplements, chemo, the way Dr. Block does it, exercise and prayer are big reasons why I am here today." And then she said, "Dr. Block told me, don't ever consider yourself cured of cancer. You must stay with the program. You may always have cancer cells that could cause problems, again, even if you're 10 years down the road." And she closed by saying, "You must change your life and your lifestyle." So, important words when it comes to your body, your biochemistry, and the root causes that brought about the cancer in the first place.